Yeah, the 5-point questionnaire is sort of like the initial screen, and then the Baton scale kind of characterizes how hypermobile you are, and that's based more on physical examination findings. But the 5-point questionnaire is a historical questionnaire. It is binary. It is yes or no answers, and it also incorporates history. So the classification systems for hypermobility, Matt, I think are bewildering, and there's limited and generalized, and there is also a historical one. And so that's where this becomes important because a lot of these things can change as we age. You can lose mobility, but if you were able to do them in the past, you might still meet criteria for them. So just to go through, I'll just knock them out real quick, Matt, is could you now or could you ever place your hands flat on the floor without bending your knees? Could you now, or can you now, or could you ever bend your thumb to touch your forearm? By the way, it has to be the ipsilateral. It's not impressive if you can touch your forearm with the other thumb.
I think that's the only one I can do, Paul.
Oh, that's pretty impressive, Matt.
Yeah.
I just popped a knuckle trying to do that. As a child, did you amuse your friends by contorting your body into strange shapes, or could you do the splits? As a child, did your kneecap or shoulder dislocate on more than one occasion? And do you consider yourself double jointed, which Dr. Bluestein says is actually probably one of the most impactful questions. But that 5-point questionnaire, if you get 2 of those, then you should suspect hypermobility of some kind. And it's pretty sensitive and pretty specific in terms of actually making that determination. So it's a nice initial scale once you start to suspect hypermobility in a patient.